When families call Florida Oasis, they usually start with the practical questions. Insurance coverage, what to bring, visiting hours. It makes sense. Those details feel manageable. But underneath, there's almost always a harder question they're trying to ask. How do we know when it's time to switch from seeing an outpatient therapist to residential treatment? Or how can we be sure residential treatment is right when I've been seeing my therapist who I trust and haven't made progress? If you're watching this, you've probably been in therapy for a while now. Maybe months, maybe years. And outpatient therapy works for a lot of people. It's designed for when you're struggling but still able to function. You're getting to work mostly, you're keeping up with the basics, even if it takes everything you have. But sometimes the gap between appointments gets harder to manage. It may start small. You're exhausted in a way sleep just doesn't fix. Maybe you're awake most of the night because it's quiet and no one expects anything from you. Then you sleep through the morning because facing the day feels almost impossible. Texts start to pile up and go unanswered. A shower becomes this whole thing you have to psych yourself up for. And then there's this guilt about canceling plans, about withdrawing from people who care about you. Here's what makes it harder. You probably know what you're supposed to do. You've learned the breathing techniques, the grounding exercises, the thought journals. But knowing what to do and being able to do it alone at 2 a.m. when you're spiraling, those are very different things. The people who come to Florida Oasis are usually exhausted, not just tired, exhausted in a deep bone level way. Most have been trying to get better for years. They've seen multiple therapists, tried different medications, maybe done intensive outpatient programs. They've dealt with side effects, insurance denials, waiting lists, and somewhere along the way they started to wonder if maybe they're just not fixable. The struggles vary. For some, it's depression so heavy that basic tasks feel monumental. For others, it's trauma that makes the present feel constantly threatening, even when they're objectively safe. Some have started using alcohol or pills, not to get high, but just to turn the volume down low enough to function. Often people come to us when something has shifted. Maybe relationships are strained to the breaking point. Maybe they've isolated so much that their world has shrunk to just them and their pain. Maybe they've realized that what they're doing just isn't sustainable anymore. This is where residential treatment offers something fundamentally different from weekly therapy. It's not just more therapy, it's a different structure entirely. Here's what that looks like at Florida Oasis. We're small and intentional. We keep our program small, just 9 clients at a time. This isn't a hospital ward or a large facility. In a small setting, staff actually get to know you. They notice if something's off, if you're quieter than usual, if you didn't eat that much at breakfast, if you seem more withdrawn. That awareness means we can offer support before things get worse. Time and consistency. Instead of 1 hour a week, you have about 42 hours of programming. This includes individual therapy, group work, specialized approaches like EMDR for trauma. But just as important is the time in between. The conversations over meals, the quiet moments, the chance to practice skills with the right support all around you. Speaking of which, you get real-time support. When anxiety hits at midnight, you're not alone trying to remember what your therapist said 3 days ago. There's someone there who can help you work through it in the moment. That repetition, practicing skills when you actually need them, is how they become second nature. You also receive integrated care. Our board-certified psychiatrist isn't someone you see for 15 minutes every few months. Our medical director meets regularly with our treatment team. Medication isn't just about managing symptoms, it's a part of a coordinated approach to support your overall healing. You also receive practical support. We handle the logistics that drain your energy. Meals, insurance coordination, disability paperwork, FMLA forms. That might sound small, but when you're struggling, those details can be overwhelming. We take care of them so you can focus on getting better. The hardest part of reaching out isn't usually the logistics. It's giving yourself permission. A lot of people get stuck asking, is it bad enough? Do I really need this? Those questions keep you trapped because there's never a clear answer. Try asking something different. What kind of support would actually give me a real chance to get better? Recovery isn't linear. It's hard work, and it's not something you should have to do alone. If you're at a point where outpatient treatment isn't enough, that's not a personal failing. It's just information about what you need right now. If you think residential treatment might be right for you or someone you love, we're here to talk through it. No pressure, no judgment, just an honest conversation about what might help. You can reach us whenever you're ready.